Ka Sorkar Meghalaya kadang Thmu banwan ra kum ka Meghalaya Health Insurance Scheme lani ka MHIS na ka Bynta ki Nongtrei jongka ha ka jaka jongka reimbursement based system u Principal Secretary jongka Health and Family Welfare u Sampat Kumar ulaong bakani ka jingterwa ka Thmu ban penduna ya ka jing penslam bat ban kentiu ya ka jing penyo ya ki lat sumar ki babiang u Kumar ulaong ba ya ka jing yakran bat ki hospital ki riu shimet kala penduna lupa ya ka jing don ki jing syak kentat ki Nongtrei Sorkar kimla ban Pyntreikam ya ka MHIS bat ka reimbursements halor ka zika case u Kumar ulaong ba amdei ban sheptin bat ba ladep ban shim ya kilat ki badai.
MHIS actually is a very good scheme. In fact, many people are very happy about it because it provides cashless facility, and because you don't require to, if you have MHIS card, you can just go and get admitted and pay and get the care. So a lot of the government servants, it takes a little time because they have to first invest themselves and get the reimbursement.
Ka Border Security Force jongka Meghalaya kala sedang